welcome to Baobab Chats. We have been on a journey of creating awareness and talking about COVID-19. And from time to time, we are bringing professionals, people who are well aware, who are dealing with it head on the front line, and who can share experience and knowledge from an informed position rather than from a speculative position. We are engaging on this journey as a way to try to assist each other and our communities to make sure that we do everything possible to bring awareness. We are joined today by our very own, and I'll ask you, Doc, to introduce yourself.
Good morning, and thank you for having me. My name is Dr. Grant Murewanhema, and I'm a doctor working in Zimbabwe. Thank you.
Doc, before we go into more detail, can you just quickly, we always want to recap, what exactly is COVID-19? You know, just as a basic recap, quick one, and then we go more in depth.
All right, thank you. So just to recap, we have to say COVID-19 is a disease. Okay, it's a disease and it's caused by a virus, which is a coronavirus, and which has been named as the Severe Acute Respiratory Syndrome Coronavirus 2, which is otherwise abbreviated as SARS-CoV-2. So you have two entities, the virus, which is SARS-CoV-2, and the disease itself, which is called COVID-19. COVID-19 essentially just stands for Coronavirus Disease 2019. And the essence of that is that it's caused by a coronavirus, which was discovered in 2019. We all know or are aware of the history as to the origins of this viral infection. It was first discovered in China in a city called Wuhan, and then because of globalization, air travel around the world, it spread to other parts of Asia, Europe, America, and then to the rest of us. And as we know, by March 2020, this disease caused by a viral infection had spread to all parts of the world, qualifying it to be labeled as a global pandemic. COVID-19 is essentially classified as a respiratory infection primarily, but which affects all parts of the body. So the basic disease presents as an upper respiratory tract infection, or what we call an acute respiratory infection, which is basically characterized by cough, fever, and flu-like symptoms. Then as it progresses to become severe, it can then actually get to involve other parts of the body. And if it progresses, it can actually cause somebody to die.
Whilst we are just there, for people who are in summer right now, mainly like sub-Saharan Africa and, you know, majority of the parts of Africa and, you know, Australasia and things like that. Once you get, because it's not a flu season, can we assume that once you get some flu symptoms at this stage, chances are it's COVID-19?
So one of the things that we always say is if you are in a forest and you're in Africa and you know where there are lots of msasa trees, if you see a tree, it's likely to be a msasa tree, but it can still be another tree. Okay, what's happening now is the majority of our people who are getting flu-like illnesses, flu symptoms, feverish illnesses, they have COVID-19. So if you develop any of these symptoms, the first thing that we should think about is COVID-19. Well, not because it's the most fatal, but because it's the one that's spreading rapidly. And if we do not take appropriate action in terms of isolating you on time, you can actually then be spreading it to many other people. So part of the reason why we assume that it's COVID-19 is to ensure that we put in place preventive public health interventions to stop its further spread by isolating you and quarantining people that you may have been in contact with, just as a control intervention. But it doesn't mean that every flu-like illness or every fever that you get is COVID-19. In fact, when you're in Africa, like you're in Zimbabwe, you always have to think at the back of your mind that there are other illnesses that have always existed before COVID-19. They will always be existing. People always get flus from time to time. Those flus we have. We have other causes of fever in Africa, like, you know, you've got malaria, which is quite prevalent in certain areas of Zimbabwe. You can still get malaria. Okay, you have typhoid, which gives you a fever. There are many other illnesses that give you these symptoms. But the bottom line is, at the moment, COVID-19 is of major public health concern because of the way it spreads rapidly and efficiently, and that's why we have to assume before we have pointed on anything that you potentially have COVID-19.
Oh, great point right there. So, like I said, Doc, this session we're mainly responding to questions and concerns that has been raised by various people based on various broadcasts that we have had, and people have seen that we are sharing the message, and people are coming with and sending us messages and asking questions to say, can you please give us answers to some of these things? So, the difference between how COVID-19 is affecting children and the elderly, because in the early days we had that it's not affecting children or it's not affecting younger people, but we have had, especially with the second wave from other parts of the world, that what is happening is a lot of younger people, teenagers and early 20s, or people that initially were assumed that they wouldn't get the disease are now getting it. But we want to hear from you. Can you help us understand this? What exactly is the situation, especially mainly based on the experience that you're having in your practice?
Okay, so I think let's take it from where it began. It's true that around the time when we had the first cases of COVID-19, the majority of people who developed serious disease, or the majority of people who actually went on to die, either were elderly, those above 60, 65 years of age, or they had other comorbidities, like they were hypertensive, they had diabetes mellitus, asthma, or any other underlying infections that could have made them vulnerable. This still holds true to this day, that if you're elderly or if you've got comorbidities, you're still more vulnerable to dying from COVID-19, you're still more vulnerable to developing severe disease from COVID-19. However, we have seen a changing pattern as far as that is concerned. We are now seeing a greater proportion of younger people also being affected, developing severe disease, being hospitalized, and even dying. The majority of these young people, from the numbers that we have, still have comorbidities, which means they still have some other medical problems that they have that are making them vulnerable or that are making them develop severe disease. One of the things that we are seeing more frequently, even though we still need official numbers to say this with certainty, is that young males who are obese, in other words, who weigh a lot, who have a body mass index that falls in what we call the obese category, which is above 30 kilograms per square meter, those are more vulnerable to developing severe COVID-19 disease. They are more vulnerable to dying from this disease. However, like you rightly said, even young children, we have now had young children actually dying from the disease as young as less than 1 year old. So I think it just affects the whole spectrum of the disease, but there are other people who are becoming more vulnerable. What is the fact is young people can contract the disease and remain asymptomatic. And that is a problem, because if you have the disease and you develop no symptoms, you can actually still go around and spread the disease. If we look at the statistics or the data from the Centers for Disease Control in America, which we call the CDC, they have now actually confirmed that 50%, which is quite a huge proportion, of all the COVID-19 infections are actually spread by asymptomatic people. And you see, this is the reason why, from a public health point of view, we are advising people to treat their peers, their friends, those who they're close to, as potentially infected, because the signs is just clear that they could actually be carrying and spreading the virus, but not show any symptoms. So yes, the disease is now for everybody. It's no longer just for the elderly or for those with comorbidities. So everybody needs to be careful.
Yeah. So from what I'm hearing you saying, we are saying in terms of the effect, it's as good as 50-50, number one. Number two, of course, in terms of severe illnesses, you get more of the elderly people than the younger people in terms of getting into severe illnesses. But the challenge is these younger people are taking the disease and running around with it and spreading it to a lot more people. So essentially, everyone is a suspect. In
Yes.
For the lack of a better term, we can say everyone is a suspect. You have to protect yourself from everyone, and also you cannot assume that you won't get sick from it. That's where we are now.
Absolutely correct. And remember, even sometimes you can actually spread the virus to a lot of people before you develop symptoms. Okay,
Yeah.
symptoms come, but there's an incubation period before the onset of symptoms. And just when the symptoms are about to start, you might actually be having very high viral loads. So these these asymptomatic phases actually can be dangerous in terms of the highest number of spread, because once you become sick, sometimes you know that you have to stay home. You
Yeah.
have to stick home, but before you fall sick, you can actually be moving around and just spreading the infection. And this is the reason why we're calling for caution and saying, look, we are in a pandemic situation, and just treat everybody as potentially infected. That way, you are safe, and other people around you are safe as well.
In the early days, there was a lot of talk about, it affects people of different races differently, be it Asians, whites, blacks, Africans. Can we say it affects us differently or is the same?
Thank you. That's an interesting question from a public health point of view or from an epidemiology point of view. I think what's safe to say at the moment is the racial disparities noted, especially in the first wave, might have been due to differential exposure to the virus in the workplace and also in the societies. You know that in some countries, such as the USA, there were a lot of younger black people who succumbed to the virus and who developed severe disease as compared to white people in the first wave. When you go to the UK, in that first wave again, there were a lot of black, Asian, and minority ethnic people who were affected and who went on to die. But that doesn't mean that black people were at higher risk than white people. In some communities, white people also died more than black people. So there were sort of differences that were seen all across the globe. But I think that really depends on the structure of the population. It depends on the population pyramid. It depends on where people work and how people work. So if you go to countries where there were a lot of, black healthcare workers, like for example in the UK, where you find many people work in the National Health Services, the NHS, being of the BAM communities, which they call the Black Asian minority ethnic communities, they were thought to be actually just more exposed, but that doesn't mean that the effects were more severe in black people. So it can actually affect us equally. As long as we are exposed to the virus, whether black or white, we are all at risk, but the differences come in terms of exposure and also access to treatment, access to testing once you contract the disease. That's what I would say. But so black people used to get a comfort that in Africa we have fewer numbers, and maybe black people in Africa might be protected by some factor that we don't know. And there were papers and studies to try and explain, to say maybe they were exposed to BCG at a younger age. We have thrown away all those theories, and we know that blacks are not particularly protected. Blacks in Africa are not immune from getting COVID-19. And the second wave is actually proving that. If you look at the numbers in South Africa, black and white people have equally been dying. In Zimbabwe, we have seen a lot of black people also just dying from COVID-19 now. So the question or the case for everybody, regardless of the race.
All right, all right, and I think that is a very because this has been a burning question, among us different communities, and I think you have really nailed it in a way that makes us understand it better. Now let's talk more about now prevention. or maybe not necessarily prevention, but reducing risk. Is there any way, before maybe we go into specifics, is there any general way that is there that one can use to boost their immune or reduce their risk before they get the disease?
Thank you. This is very important because for now, prevention remains our major tool. Why? Because we have not yet any treatment that we can call particularly effective or curative for COVID-19. So the best way of protecting yourself is to make sure that you don't get disease. Now, in terms of prevention, we need to remember that there are things that you can do at individual level, there are things that can be done at societal level, and then there is what the governments and the public health systems can do to protect the people. But the most important things which are within your reach is what you can do as an individual. So the thing is, we have talked a lot about, wearing of face masks. We've talked a lot about physical distancing. We have talked a lot about hand hygiene, cough etiquette, sanitizing your hands regularly, staying put where you are and traveling only when it's necessary. But we also need to remember that your health is a function of your immune system. And your immune system is a function of several things that are within your control. Number one, your nutritional status. That is very important. Okay, this is why in Africa there is a lot of hype about what we eat, about herbal remedies, about zumbani, about moringa, about all these other things. These are things that are not really new. These are things that we have known from time to time, and we have eaten them, and we know that they have got good nutritional properties. What the modern equivalent of this that we are saying is just that eating a balanced diet that contains all the essential nutrients, the vitamins, the trace elements, because those are the things that help you to fight against any kind of infection, be it COVID-19, be it any other viral infections. If you're eating a good balanced diet, you obtain all the trace elements, the vitamins that are essential as antioxidants and as core factors in your immune system to help you fight against disease. So nutrition is very important. Okay, physical exercise becomes also very important. We should be physically fit as individuals. And how do we become physically fit? We exercise. Okay, this is something that we must have been doing even way before the COVID-19 pandemic. We're supposed to be exercising to maintain our physical fitness because that, gives us the ability to stand physical diseases, to clear infections quickly, but also helps to prevent against the major comorbidities that have been causing problems in COVID-19, which are diabetes, hypertension, and obesity. If you look at diabetes, if you look at hypertension, if you look at obesity, they are all lifestyle diseases, okay, except for those who have got a genetic component to their diseases. A lot of these are actually a function of how, of what you eat and how you live, a sedentary type of lifestyle. Somebody who just stays and works in their office all the time and never does any exercise, they are at risk of these lifestyle illnesses. So these people who have these same problems are also more vulnerable to COVID-19. But it's not late. The exercise can actually start at any time, even now. And exercise is not something that you always obtain from professionally qualified people. It's something that you start yourself at home with whatever you have, even in lockdown times, jogging, press ups, a lot of all these exercises that they help you, but they also actually just help you to start reducing your weight. They help you to control your disease so that in case COVID-19 comes to you, it becomes less severe than if you have uncontrolled disease. So that's important. But the other important thing is now for those who've got these particular illnesses or those who are vulnerable, you should make sure that you get in touch with your medical practitioners, your GPs, so that you optimize control of whatever disease you have. If you have hypertension, make sure you're taking your medicines. If you're on medicines, Make sure you are on that low salt diet. Make sure you are eating as you are told to do so that the disease is optimally controlled. If you're diabetic, make sure that the diabetes is well controlled before you develop the disease, because controlling these sugars once you have COVID-19 is actually very difficult and is killing a lot of people. And of course, try and reduce weight as much as possible now before the disease comes to you, particularly truncal obesity. You know, if you're a guy with a pot belly, try this time to actually be working on your pot belly. Replace all that fat through exercises with muscle. So build muscle, exercise. And these are things that you can do as an individual to try and protect yourself. Okay, so we cannot overemphasize these things, but in addition to these things, then just remember to go to the basics that we preach about again. Mask up all the time in public spaces. It's mandatory in Zimbabwe to do that. Okay, physical distance whenever you're in public spaces or places with other people. This means that you need to leave a distance of at least a meter. 1.5 meters is better between yourself and the next person. Okay, sanitize your hands regularly with alcohol-based sanitizers, at least 70% alcohol-based hand sanitizers, or wash your hands frequently with liquid soap. Every time you touch something, just wash your hands with liquid soap under running water for at least 20 seconds. Cough into your elbow, or if you cough into a tissue, just throw the tissues away. These are things that you can just do to protect yourself. Don't go into public spaces unless it's really, really necessary for you to do so. And avoid unnecessary contact with surfaces, avoid unnecessary contact with your nose, your eyes, your face, because these are some of the ways that people get infected, touching contaminated surfaces. So these are some of the things that you can do as an individual to protect yourself, whilst you're following what the governments in your different settings are also telling you what to do, so that when we do these things together, we will reduce our risk significantly.
Yeah. So, Doc, you just dished out a whole lot of information, and we are so appreciative. And I'm fielding some of the questions that already people are sending me because there's a huge chunk of people that know that I'm currently running this interview with you. Now, just on these things that you've spoken about exercise, you've spoken about diet, you've spoken about general health consciousness and things like that. But I want to ask now, most of us are in these situations. I know, of course, you explained in terms of, say, exercise, right? Or nutrition, where we are not economically or financially that well off to be able to afford a lot of fancy things that we hear. So we want to go into the basic things that we can use. Of course, you have already given examples like moringa. You've given, examples like zumbani and things like that. And people talk about guava tree leaves and talk about gum tree leaves, all sorts of. But let's talk about those natural remedies now a bit more. We know people are taking this. I think the most prevalent ones I've heard about is moringa, zumbani, guavas, gum tree. Are these safe? Let's start from there. Just safety in terms of how one should take it, or is it safe to take, and is it safe for all different ages? Maybe let's start from there.
Okay, so on this one, we have to be clear that the views that I'm going to be giving are my own personal views. Yeah. And these are based on my personal experiences, my reading, and my understanding. Okay, natural remedies are generally food. I think this is one of the things that we have to emphasize. Okay, if you look at all the natural remedies that people tend to use, the majority of them are actually food. It's things that we have eaten, things that our ancestors have eaten for hundreds of years. And most of them tend to be safe, okay, as long as you are eating what you know, or what you've been shown by those who came before you that this can be eaten, the majority of them are actually safe. Okay, they are known to be immune boosters. You know, some of them have been studied in the labs, like moringa, for example. It's been studied by people at PhD level, and they've actually been proven to be quite beneficial as an immune booster, which can actually improve even white cell counts in people living with HIV and AIDS. What they are not, and this is the most important point, what they are not is that they are not treatment for COVID-19, and they should never be used as substitutes for treatment. Okay, so you can take them before you get the disease, you can take them when you have the disease. But what's important when you have the disease is you have to consult your medical practitioners, okay, to be assessed for the need for medical treatments, to be assessed for the need for hospitalization, to be advised for the need for hospitalization so that you are treated appropriately for supplemental oxygen therapy. But nobody will stop you from taking these as long as you know what you're taking, because most of them are particularly safe because they are food and they just contain the essential nutrients that you're also looking for when you go for a balanced diet. I mean, we have to emphasize that the things that are of benefit are not necessarily expensive. In fact, most of them are actually quite found freely available in most parts of Zimbabwe, rural Zimbabwe. If you go into a bush, you are most likely going to be finding leaves of these. You're likely going to be finding fruits. And you know, the difference is you buy these somewhere in a packaged form and they become more expensive. But when you get the natural form, it's quite cheap. It's like when you talk about vitamin C. Vitamin C is essentially derived from citrus fruits. Okay, you have a lot of oranges, lemons, and so on. And you know that vitamin C is very good. We advise people with common colds, that's the flus, to take it. We also advise people with COVID-19 to take vitamin C as much as they can. So you can just acquire the same from eating a lot of oranges, you know, drinking orange juice, Mazoe Orange Crush, if you are in Zimbabwe and you're still getting the same vitamin C. So good is not always necessarily expensive. This is the point that we need to always be driving home, that with whatever we have in our communities, we can actually get a lot of nutrients, and most of them are quite safe actually. And some are even better when they are eaten in a raw form than in a cooked form, because when you cook them, you actually cook and, you know, throw away some of the essential nutrients that you're actually looking for. But what's always important is to make sure that the elderly people in your area also know about these remedies, because they know what has been eaten. And the other important point, like I said already, is to know that these are not treatment. So once you are sick, this can never be substituted for treatment.
So on that, Doc, and that's, so when you take a lot of these natural remedies, right? Should we say it's mainly preparing your body that if you get sick, your body is able to fight the disease, but they do not prevent the disease? Is that correct to characterize it that way? Is that a correct characterization?
Absolutely. I think what you're basically saying is you're just preparing your body to be able to fight. Okay, they will not stop the infection coming into your body, but your ability to withstand and your ability to develop severe disease will be improved by this. So they're essentially measures to boost your immune system, to make you a stronger person, not just for COVID-19. Because remember, these lifestyle issues, we are supposed to be talking them, not even just in the context of COVID-19. These are things that we're supposed to have talked about from years back, okay, as things that make you stronger in terms of fighting even the common flu and other diseases. You know, so these are things that we're supposed to be doing from time to time. We're supposed to be eating well all the time, preparing our bodies for the eventuality that when we get infection, we should be able to fight it and get less severe disease.
Wow. And then whilst we are there now, Doc, let's talk. There's this thing of steaming that people are doing, where people, you know, put hot water in a container and they can put different types of herbs, cover themselves, their heads in, you know, underneath, breathe that, and, you know, there has been talk about it kills the virus, if it's in your nostrils or in the airways, or it opens up the airways for you to breathe. Is this a phenomenon that is recommended for people before they get sick or after they get sick? Does it work as a preventative measure, or it's more about trying to assist the body to deal with the virus when it's already there, especially issue of clearing up your airwaves?
Again, I have to emphasize again, like I said earlier, that this is my personal opinion. I think steaming is something that's also been done. It's something that I'm not particularly a fan of because of my personal experience as a doctor, where I came across people with inhalational burns from this practice. And unfortunately, also even in the UK now, I think I just read the paper recently that reported an increase in the number of reported inhalational burns among pediatric patients from steaming. So if you are doing it, you have to do it correctly. Okay,
So
you have to.
my
Yes.
apologies, Doc. I need you to break that down. This inhalational burns. Can you break it down in more simplistic terms? Because this is a practice that a lot of us are doing right now. What exactly is inhalational burns?
Okay, so in simple terms, this basically means that if you use excessively hot steam, okay, you're going to burn or cause injury to your airway lining. Essentially that. So you damage your airway lining because you have inhaled or you have breathed in very, very hot steam. This is why it's important to use the right temperatures, which I'm not aware of. I don't know which one is the right temperature and which is not, because it's a practice that I'm not a fan of. But yeah, that's one of the dangers that's been realized. And I think what we have to emphasize is that, number one, steaming does not prevent you from getting COVID-19. The science is very clear. Number two, steaming does not treat COVID-19. It does not get to where the viral particles are, so there is no way that it cures this. But if it gives you relief, because remember what people are looking for when they're doing these practices is they're looking for relief of symptoms, and nasal congestion is one of the symptoms. If it gives you the relief and you do it properly without damaging yourself, I don't see why you shouldn't do it. The important thing is to make sure that you don't harm yourself. And the other important thing is to make sure that you are not replacing it with medical therapy. And if you are steaming with chemicals or herbs, make sure that you are also using herbs that are not going to be toxic to your lungs and to your other parts of the body, because this is a real tragedy. When you do something because you think it's beneficial, but then you mix it with something that's not right, and it ends up harming you. Okay, so you have to do it right, and you have to use the right temperatures. And if you mix it with any substance, you have to know what you're mixing it with, and you have to know the safety properties which depend upon the various substances that people are using to mix it.
So I think what I'm hearing you saying, Doc, and thank you so much. I'm hearing you saying, I cannot say yes, I cannot say no. Based on my experiences, there are certain challenges. This is something that needs to be done with caution.
Absolutely.
And I think from that, one takeaway as well is to say, I think then if you're doing it, we need to work around to regularize how much are you doing it, what temperature are you doing it, because I've heard people doing it 3 times a day because people need to go out there, and the challenge of a possibility of now thinking, because I'm going to Natira or I'm going to Kufukira, I'm going to do this process, then I'm going to protect myself so I can go outside. I don't need to have my mask, or I can have close contact. So that is the main takeaway I'm getting from you on this.